podcast. We're headed into week 3, and I'm here with Kenny Matthews and Terrence Johnson. This week we've got a special guest, Dr. Elizabeth Eversull. So, hello, welcome to our show.
Thank you. Happy to be here. I can't hear.
What is it?
Hello? I can't hear.
Yeah, I can't hear either.
I don't know what that sound was, but it's gone now.
I heard a dump
Sounds
truck
like
back
now.
in August disposed of. That's what it sounded like.
Sound like a dump truck backing up.
That was
Lauren
crazy.
Moore, take 3.
That was crazy.
Week 4, Terrence Johnson and Lauren Moore.
Okay.
Week 4 too. You said week 3.
Oh yeah, week 4.
Yeah, week 4. So you're good. We'll try it one more time. Everybody be quiet.
Miss Doctor,
Lamb.
Okay.
welcome to Behind the Scenes, Doc. This is what get us paid, these bloopers.
Great. I'm starting to feel a whole lot better.
All right. Lauren Moore, Friday Night Glory Out of Bounds podcast. We're headed into week 4, and I'm here with Terrence Johnson and Kenny Matthews start out this week. Our special guest this week is Dr. Elizabeth Eversull. Hello, welcome.
Hello, happy to be here.
How you doing, Doc?
Welcome to Out of Bounds, Doc.
Thank you. Glad to be here.
So tell us a little bit about yourself. Where did you go to school, and how did you get into your field?
Right, so I went to undergrad at LSU, New Orleans, or LSU Baton Rouge, and then med school, LSU New Orleans. And then I got to Texas. I came here for my residency training in physical medicine and rehab, which deals a lot of times with sports medicine, but other injuries like strokes and spinal cord and all that as well. So I went through that at UT Southwestern and Parkland and so forth. I got out. I got hired real early on as an interventional pain management doctor, and really quickly realized that a lot of the people that came into clinic had a lot of chronic pain, all kinds of metabolic problems, etc. And what we were doing was injecting them with a lot of steroids, giving them pills, you know the whole thing now with the opioid crisis, right? And so I really quickly started to look for other ways to help with these problems. And that led me into learning different and new techniques, such as prolotherapy, neuroprolotherapy, it sounds complicated, but it's rather simplistic in some ways. But different techniques to help with their pain, and then also that leads you more and more into understanding the metabolic problems, the hormone problems, nutrition issues, and also adopting a lot of these physics-based treatments, such as the pulsed electromagnetic field mat or PEMF mat that we use, and some other equipment that helps with inflammation and so forth. So
That's awesome. We were all really excited to have you on tonight, and what you're telling us before the show starts about your couple of cool devices that help oxidative stress and recovery and pain of all, most importantly, just ridding that pain. So talk to us a little bit about those devices.
Okay, the first one is called a Beamer mat, BEMER. This mat is the pulsed electromagnetic field mat. And what it does in short is very simple. It's kind of like a yoga mat that you can lie down on, and it just takes a few minutes, and you don't feel buzzing or tingling or any of that sort of feeling, but you may feel a little bit of warmth in the tissues that are closest to the mat. But what it does is, in real time, it opens up the smallest blood vessels that you have, the smallest ones in your body, opens those up really wide and delivers fresh blood to all your tissues. And in doing that, it oxygenates the tissues and it takes all the toxins away very quickly that have built up there. And so it's pretty cool. It works very quickly. You can see changes in people's, if you draw a little bit of blood, a little blood droplet, within about 2 to 3 minutes, that blood will look very different than before they got on the mat. It's really neat.
That's an awesome technology, Dr. Eversull. Kenny, I know you have some questions.
Absolutely. Well, hey, Doctor, how you doing? It's so nice to have you on here on our podcast. I'm back this week. Sorry I took off last week. I have to do a little schooling myself. So yes. Let me ask you this a little bit. It seems like it seems like the injuries have been evolving over the years. It seems like a lot of these injuries are soft tissue injuries now. That seems like in our athletes and all. Are you getting more of that? You know, are you starting to see that become a bigger factor in your medicine, or in your practice, I should say?
Some, I would say a lot of tendonitis, bursitis, that sort of thing, patellar tendonitis, the shoulder, obviously rotator cuff issues. Frozen shoulders, that kind of thing, definitely. Still the arthritis all the time too, and degeneration of the knee meniscus and so forth. But yeah, I would say quite a bit of the soft tissue injury too. And part of the reason that the white connective tissue is so vulnerable is that it doesn't have a very good blood supply, and it's hard for it to heal and regenerate. And so that's why some of this technology is so good. It's very difficult to substitute with an injection or a pill or whatever blood flow.
Gotcha.
It's hard. So this is cool. It's really good for that.
Yeah, I'm glad you brought up the tendonitis and the arthritis and all that. So many people keep asking me, why is there not a cure for it? Why isn't like we can do this, we can do triple bypass surgery and all that? Why is something that seems simple for the layperson? What is the main reason why that there's probably not a direct cure for it, when almost just kind of treating the pain to try to get through the day?
Yeah. Well, it's not that there's not a cure for most things. You just have to kind of figure out and unpeel that particular person's reason for having it, whether it's nutritional, whether it's metabolic, whether it's a chronic overuse or an imbalance of the muscles that are moving the tissue, stuff like that. Yeah.
Hey, that's a great answer. I never really tried to look at it, I guess, from the nutritional side of that. You see so many athletes say, I've got this bursitis in my hip and my knee, and you see them doing the various, cool, the ice, the ice treatments, then the heat treatments, and the thermal, thing that they're doing now. It just seems like, they always keep asking about, why is there not a definitive cure? And I always thought it was just because everybody's a little different. On that.
And that's a succinct way to say it, for sure. But you have to kind of look at the person very globally or holistically and so forth, even though I don't toss that word around a lot. But yeah, you really have to look at that whole person. And sometimes they'll have something going on where they've got an imbalance in the arch of their foot, something like that. And as active as these guys are, guys and gals, that little thing can make a big difference. Little things like that.
Well, my last question to be to you is that what's the biggest change in this pain management since the time you got once you do your residency to what it is now?
Oh, by far is, I can tell you that immediately. When I was in residency and in training, they were pushing us to push opioids and pain medication and stuff. And let me tell you, we had to ask about pain at every visit. They considered it the next vital sign. And if you did not treat that pain according to what the patient said, you were under the gun. And so it was really, really opposite day then. And now, of course, everything has changed because there's been so many addictions and deaths and everything, the opioid crisis. So now it really has shifted to what can we do that's not an opioid? What else is there? And so people have really become so much more aware of the danger and the risk of that. And so we're getting a lot more people looking for alternatives and being a little bit more open-minded to some treatments that they may not have heard of already in order to avoid that.
Oh, that's interesting. I never really thought it'd been such a 180, from that. And it's not that long of a period of time, but yeah, I mean, with the opioid crisis the way it's going now, I mean, you almost have to find an alternative.
Yeah.
You're almost at that point.
Yeah, every now and then, somebody will come in with a big ruptured, Achilles or something like that, and I don't mind giving them a few pills, a few pain pills for that. I mean, they're at the crisis time, but past that, we really have reduced the opioid. Even in chronic people with multiple degenerative issues, we've reduced it dramatically. And some people need, a little bit, and they're fine, they're stable. But I would say 100 times over, answered your question, would be that.
Well, that's some really good stuff there, man. It's thought provoking, and it also kind of changes my thought process a little bit about, how to, to do this. And I appreciate your time here, man. I really do. Thank you very much.
Oh, you're welcome. Happy to be here.
All right, Terrence, your turn. What else did you have for Dr. Eversull?
Yes, Dr. Eversull, Terrence Johnson here, Friday Night Glory. I have a lot of pain in my shoulders and back. I used to use a TENS unit. How well is your product, versus those TENS units? Those kind of old school to have a TENS unit right now.
Yeah, I mean, hey, it's not wrong. I mean, it works in a pinch, right? So TENS unit works while you're using it. Okay, so it's using a little bit of a technology where it's tricking the pathways into your spinal cord. It's tricking that, and your body can only really receive a certain stimulation at one time, so it can focus more on that tingling, right, than your normal pain, than the underlying pain. And so it uses that pathway and it keeps it really busy, so your original pain doesn't seem so much. That's kind of the theory behind that. And it works while you have it on. I'm sure you have noticed that. When you take it off, not so much. So the difference is in this therapy that I'm talking about is you're actually changing the physiology more, and you're getting more of a detoxification, lymphatic movement, blood flow, and a likelier healing response than you would with just the TENS unit itself, for sure.
See, I was an athlete before too. The opioids, I was on them strong. About a couple of years ago, I went to a surgical clinic where I took injections for 2 months, kind of rid the pain in my lower back. I had an L5 dehydrating disc, and it was kind of pushing that nerve. And it feels like it's coming back. And I know, like you say, they try to wean you off opioids because, doctors don't care. They want the money, but we really want the healing. So with your product, do you think that's something that, like you say, we can get rid of the pain, but it just depends on the person with the pain? How confident are you in those products that, hey, if I get some treatment, I'm going to be like, hey, go to Dr. Eversull. She rid all my pain. No more doctor visits, no more opiates, no more laying on the floor, rolling on the phone.
You're exactly right, because the better that you are, the worse business person that you are in some ways. Like the Chinese medicine guys, back in the day, they would only get paid if you didn't get sick.
Oh.
Right.
Yeah, so you're right. The better job we do, the less you come back, and there you have it. You got to tell all your friends. But so this particular mat, and I'll talk to you about another product too. But this particular mat, whenever I recommend it to somebody, it's expensive. Because some people come to my clinic and they use it. Some people buy them for home. And I say, every time, if you want to buy this for your home and you don't like it after about 6 weeks, I'll buy it back at the wholesale cost, which is still pretty significant. I'll buy it back. That way you've had a rental, you've gotten to try it out, and there you go. And I've sold 100 of these things, maybe more, and I've never, not one time ever, had someone sniff at my offer. They are gone. They get them and they're gone.
They go.
I have a lot of people with very, very degenerative spines. They've had hip replacements, tons of hip injections, tendonitis, shoulder replacements, everything. And all they want to do is play golf. That is all they want to do. and maybe have sex. But
hey,
well,
hey,
it is what it is. And
hey, we're natural. We're human.
it's what you do. And but they've got to be able to do either of those without wanting to die. And I've got
your wife.
many of my golfers will not. They may go 2 days without their mat, but if they're going to take a trip that's more than a couple of days, they're bringing the mat with them. They pack it. They pack it in the suitcase. That's that. And so that tells me right there that's something.
Cheaper to keep her. They'll leave them. Get that mat, fellas.
Yeah.
And another, one more thing I would ask you about. Have you ever interacted with a lot of high school players or any coaches in the Metroplex here in DFW?
Not really. Not yet. I'm open to doing that. I love the kids, and I respect the heck out of coaches because they're shaping kids and they're teaching them a lot of life lessons and the team, the cohesion. And so I'm really interested in doing that. I have multiple sort of singles like the gymnast and individual lacrosse players and things like that, but I don't have specific teams that I deal with.
Okay.
Well, hopefully Friday Night Glory can be a stepping stone here for you. We get in contact with UIL. They got to have their hands in it. So,
well, we got to get her down to coach's school.
Hey.
That's what we need. We need to get you down to coach's school for the booth in the summer.
Man.
That sounds great. That sounds really great. The other thing that these guys would love, just real quick, is it's called a NanoV. And this thing it sort of looks like an oxygen machine, and you breathe it. You breathe in just like the people in the hospital with the oxygen up the nose. Okay, but you breathe that in, and it is magnificent for the oxidative stress. So when you overtrain, when you've had a couple of big games, and you know how you feel like, dang, I can barely move. I got to get up these stairs. I'm feeling rusty and wiped out. This is like an eraser pen for that. It is incredible. Also, if you travel and fly a good bit and you feel just nasty, dehydrated, you know that feeling when you get off a long flight and you're so tired and you've been up for 30 hours. You literally can inhale this it's really air, but it's treated in a certain way from this machine. And it feels like you've had a nap and a shower and you're ready to rock. It is the coolest thing. In fact, I bought this product. I'd flown to a conference, gotten stuck on the runway, had a horrible day at work, stuck on the runway, long flight, delay, stuck on the runway again at the next, airport. You got to rent a car, drive an hour and a half, blah, blah. So you feel like absolute, a smashed ant. And so I get there and get up, eyes all sticky, just nasty. And I'm going into the conference and someone's using this machine and they're like, look, oh man, you need this more than me. You look terrible. I'm like, be honest. So they sit me down on this stupid thing and I start using it. Within about 7-8 minutes, I felt just like I was telling you, like you had a shower, a nap, a massage, and you're good to go. And I was like, I'm going to write a check. And It's thousands and thousands of dollars, but I don't, I don't spend money lightly like that. I'm like, whatever it is, it's going home with me. And I've had it ever since. Yeah. Like, if it can do that for me, what can it do for my people that are really needing it? And love it. And it does actually help. I've got some patients that have bought one too, and they use it every day. And they tell me that because I really don't use mine every day. I only use it when I feel like crud. And, because it's at the office and whatnot. But they tell me that it really, really helps with their pain as well. So what it's doing is it's creating, when you create that oxidative stress from metabolism, from using oxygen, working out, eating a lot, eating bad food, whatever it is, you create that oxidative stress, it actually helps destroy proteins and it injures DNA and the whole thing. When you create the free radicals, basically, there's a couple of kinds of them. One is very destructive, and the other one is actually a signal to help repair the tissue. And what this machine does is it captures that signal from the repair free radical, and it is what you're inhaling. So you're inhaling this frequency of that repair signal. And so it does not prevent any free radical issues. It doesn't prevent the oxidative stress and the damage from that. It unwinds it and repairs it. So it's pretty interesting. So you can do treatments like take antioxidants and so forth, but the antioxidants are going to help to partly shut down the good free radical pathway too. So with this, you kind of get your cake and eat it too, if that makes some sense.
I'm throwing my antioxidants out, so I don't need those. I take them like every day. I'm on the wrong thing.
I'm not saying to do that. I'm definitely not giving you, medical advice, but some is good. A ton is probably not as good.
Okay, I take some, not a ton.
Everything in the dose, right?
That last advice, I mean, that seems like that would be good for people that have allergy hell, to give them the energy. I felt that way yesterday. It seemed like that could have been a nice pick-me-up. And it also could be used for somebody that might have had too much to drink and help them.
You got where I was going with it. But yeah, oh my goodness, a hangover, absolutely. Not that any of us really do that very much, obviously. But with that,
we'll talk about that off camera
for a second. But yeah, it's also like someone with a really bad stress headache or migraine. I've seen that really crack that. So it's very powerful and very safe and easy. You can even have it on kids. I like stuff you can use on kids, pets, anything. In fact, the other one, the mat, they actually have that for racehorses. They'll use it on racehorses to help them with recovery, which is cool because there's no placebo effect.
Right.
Or you don't know. And so they have them for pets and horses and things too. So it's pretty cool.
That's awesome.
Yeah.
Very awesome.
That is.
I love it.
Is she a chiropractor?
So, Dr. Eversull, if any of our listeners would like to contact you about an appointment or discuss the devices, how could they go about that?
The easiest way is go to www.handmadehealth, altogether, handmadehealth.com. And all of our info is on there. In fact, we have links to the different products that I was talking about and some other cool products too, and some descriptions of how we work.
All right. Well, thank you very much for joining us today.
Thanks for having me.
Appreciate you, Doc. I'm going to that site when we're finished with this podcast.
All right, sounds good.
Yes. Thank you so much, Doc. Man, that's wonderful. You have some wonderful products. That's something I'm going to definitely go take a look at. No question.
We all are. We're going to put it on Randy's tab. Hey, Randy.
Interested too.
Yes. Thank you so much.
Okay, thank you. Do I just click out?
Yeah.
Just want to hang out, talk a lot of football.
All right.
Bye.